So I hope everybody had a good 4th of July. I took a day off, and we all do. So we all know the big, beautiful bill passed. And there's a couple of topics there that I think are important for Indiana. And I want to start with Medicaid, the cuts. And then hopefully, not this video, but the next video, we'll talk about no tax on tips, Social Security overtime, because that's a lie as well. The fact that they said they're not cutting Medicaid is a lie as well, too. So I've never been on Medicaid, so if you haven't, I'll give you a quick overview of what it is. It was started in '65, and I took notes because there is a lot of information. And as smart as I like to think I am, I'm not going to memorize this all at one time. So I figured we better have notes. I feel weird reading it off to you all, but it is what it is. All right, so Medicare was started in '65 as part of the Social Security Act. The primary goal of Medicaid is to provide medical assistance to those with limited income and resources. So in Indiana, and I'll put this up too. Indiana, we have 1.833 million or 1.8 million children and adults that are enrolled in Medicaid. Among all Medicaid enrollees, 2 in 5 or 39% are children. 1 in 4, 23% live in rural areas. 1 in 9, 11% have 3 or more chronic conditions. In Indiana, Medicaid covers births. 41% of all births in Indiana are covered by Medicaid. Children. Now, children don't get to pick or choose if they have parents who are wealthy or have good jobs or have a good insurance plan. They don't. We all can agree on that. Kids don't get to pick and choose this. 37% of those kids are covered. Adults, 19 to 64, the people who they all say aren't working, is only 17%. Working age adults with disabilities, 44%. Medicare beneficiaries, 17%, because you can be on Medicare and still qualify for Medicaid. Nursing home residents, 66%. Okay, so these aren't a lot of these I just read off to you are not able-bodied adults who just refuse to work. Okay, so a majority, 72% of Medicaid adults are working in Indiana. Medicaid covers from 20% to 42% of people in Indiana's congressional districts. So I am in the 6th congressional district, Jefferson Shreve. In my district alone, there are 15,221 people on Medicaid, which is 17% of the population. Okay? And as I was doing some research on this stuff, I think the reason people believe they aren't going to have Medicaid cuts, because they keep saying they're not going to cut Medicaid. Okay, so we have about 5 plans in Indiana. Only one of them is called Medicaid. It's traditional Medicaid. Okay, that is a fee-for-service program that provides comprehensive coverage to individuals with low income. It serves individuals under 60, those eligible for certain home and community-based services, and those dually eligible for Medicare and Medicaid. It also covers individuals in nursing facilities or ICF, IID facilities. Okay, then if you're on this plan, you're on Medicaid. Healthy Indiana Plan, HIP. Remember those commercials? I remember those commercials, okay? This is a health insurance program for adults with income at or below the federal poverty level. HIP offers 2 options, HIP Plus and HIP Basic, which provides access to various health services like doctor's visits, prescriptions, and hospital stays. HIP Plus offers more comprehensive coverage, including dental and vision care. Now remember, this is Medicaid, okay? If you're on this, you're on Medicaid. You might not think so because you don't hear the word Medicaid in it, okay? Then we have Hoosier Care Connect. This program provides managed care for individuals who are aged, blind, or disabled and not eligible for Medicare. It includes coverage for those in nursing homes and those receiving home and community-based services. Again, Hoosier Care Connect, Medicaid, okay? Then we have Hoosier Healthwise. This program provides health insurance for children, pregnant women, and some adults. It includes Hoosier Healthwise package, a full service plan for children and pregnant women with no cost sharing, and package C, a full service plan for children in the Children's Health Insurance Program, CHIP, with a small monthly premium and copays. So again, these people are paying something for this. My camera's tilted a little bit. They're paying for this. They're not freeloading off of this program. Again, this is Medicaid though. And then we have other programs. We have Indiana Pathways for Aging. That's for adults needing long-term care services. We have Hoosier Prescription, Hoosier RX, a program for prescription drug coverages. Home and Community-Based Services, HCBS. These waivers provide support for individuals who need long-term care services at home or in community settings. Then there's this Medicare savings program. So you know that's Medicare. Family and Planning Eligibility Program provides access to family planning services, and Medicaid Rehabilitation Option (MRO) offers rehabilitation services. Tongue-tied, right? So a lot of these programs are Medicaid, but you don't think they're Medicaid probably because you don't hear the word Medicaid in them. So we go to that. We have a lot of people on this, and it's going to hurt a lot of people. But before I go into some more numbers, let's talk about the politicians that we have in this country who dehumanize these people. And I just read you this, and I'll put this up. A majority of these people are working. They are working jobs. They're working low-wage jobs that don't provide benefits. So we had Joni Ernst most recently said when somebody asked about Medicaid cuts risking lives to people, she responded, well, we're all going to die. If we're I can't top that, I don't think. Then we had Senator Tom Tillis in a 2011 speech, and he's a current senator. He voted against this, but this is what he said in the past. In 2011 speech, later resurfaced in 2014, he said, what we have to do is divide and conquer the people who are on assistance, so others look down at these people who choose to get into a condition that makes them dependent on the government. He said that. He is saying these people are choosing to be this. 72% of them are working. They're trying to get out of it. Okay? In 2017, Senator Roger Marshall claimed that poor people just don't want health care and aren't going to take care of themselves. And then we had Senator John Kennedy, Louisiana, have referred to Medicaid expansion enrollees as able-bodied adults without dependents, suggesting they're loafers undeserving of help. They're working. Again, I've read you the statistic. 72% of people on Medicaid in Indiana are working. Okay? Rep. Gabe Evans, Republican of Colorado, said they must work part-time. So he's saying that they're lazy. There's many reasons why people get working part-time. Taking care of kids. You're going to school. That's two right there. And then I remember this in the 80s, growing up. I was born in the 80s, so I remember the Reagan years a little bit as I got older. And Reagan said, welfare queens. And he painted a vivid caricature of black women with multiple aliases living lavishly on welfare and Medicaid. She has 80 names, 30 addresses, getting food stamps, Medicaid, tax-free cash, income of $150,000 a year. So if you take $150,000 in 1976 in today's dollars, he is claiming this person or people were getting $847,000 in today's dollars. Because that's how much $150,000 was back then. So they use this dehumanizing language. So we look down on people, but we want people to work and we want people to go further in life. And if this program helps them, and they're paying into it. And I'm about to get into that right now. How is Medicaid funded? All right. So, on the federal level, Medicaid's funded comes from general fund tax revenues, including income taxes, and there's other federal revenues, excise, tariffs, taxes, etc. So the state level is funded through state income taxes, state sales taxes. There's state-specific healthcare taxes. Some states they tax the hospitals, and we do that here. Lottery and tobacco. So the provider fees. So Indiana, how we fund it here in Indiana. State general fund, mostly from sales and income taxes. So we have a 7% tax here in Indiana. Rich or poor, you're paying that 7%. So you're paying into the system already, regardless of your income. Poor people pay sales tax. There's no write-off for sales tax I'm aware of. I know there's a SALT on your taxes for the federal taxes, but if you don't make enough money, you don't get to write it off anyways. There's a hospital assessment fee, tobacco taxes, and there's a federal match. We get about 66 to 70% federal matching for what we bring in for this. So sales tax, again, 7%, and that doesn't count for food and prescriptions. We have a flat 3%, 3.05% state tax. And then there's the provider fees. There's our fees imposed on healthcare providers to generate revenue and unlock federal matching dollars. The hospital assessment fee, collected from licensed hospitals, acute and psychiatric. In 2024, hospitals paid 1.6 billion in the hospital assessment fees. Okay, this generated about 5.5 billion in federal Medicaid matching funds. We have the managed care assessment fee. That's new for this year. It's a fee on insurance companies, so we're all paying it. If you have insurance, you're paying it. There's a cigarette tax. And then, so people like to say that the poor don't pay into these systems, but they do. I just laid it out for you. How it's funded, they pay into this. Even if you get a tax return from your federal taxes back, you're still paying taxes throughout the year into the system. And then you get a refund at the end of the year, but it's still coming out of your paycheck every month. Sales tax, you pay whenever you go out. So if you don't buy food or medicine, you're paying a sales tax. If you go take your kid out for a treat, you're paying taxes. If you want to take your kid out to see a movie, you're paying taxes. If you want to take your kid out to go see a baseball game, you're paying tax. You're paying taxes. You're paying into the system. You're not being lazy. You're not stealing. You're not ripping the system off. Okay? So we know that. Oh, sorry. So when people say these things, it's disheartening that people are out to get people trying to live a better life. And so how does the Big Beautiful Bill play into this? So over the next decade, Indiana is projected to lose $23 billion. So they're also reducing the provider tax, is going to be reduced from 6% to 3.5% over the time. They're going to change eligibility changes, work requirements, frequent income checks, co-pays may limit coverage. Medicaid recipients, thousands could lose coverage or face barriers to maintaining it. And rural hospitals, there's 12 of them in Indiana, with potential closure, layoffs, service cuts. So we talk about how we want these people to join the economy, work, and get off of this stuff, right? But when you're sick and you can't get health care, you have worse outcomes. If you're sick and you can't get medication, how can you keep working? Let's just say you are asthmatic, all right? You need to get an inhaler. And let's say, I know my son used to use QVAR. Without insurance, that's $300 a month. A month, okay? So you have somebody that's working poor, barely getting by, and you tell them, hey, we're not going to help you. Just go ahead and get sick. Like Joni Ernst said, go get sick and die. We're all going to die anyways, right? But people who are healthy and have healthier outcomes will work longer. They'll have more advancement, and they'll contribute more to the economy. Because the ultimate goal with these programs is to help people get through these tough times. And like I've said, I've been growing up. We lived in government housing for a little when I was a kid, and we were on food stamps. I don't think we were on Medicaid. I don't even think my parents really knew about it, because there was times when we didn't have health insurance and we just didn't go to the doctor. I remember I busted my knee, and I got lucky enough that my school trainer in high school took care of it. And we were worried that I had a torn ACL. Turned out I didn't, thank God. And I got lucky, and it was a horrible strain. Nothing was torn, and I was fine. So I don't know if my parents didn't know about these programs or might have been too proud. But sometimes people just need help. And what our government doing now is making tax cuts permanent for the ultra wealthy at the expense of people who actually need help. I don't think Jeff Bezos needs more help from the government. I don't think Elon Musk needs more help from the government. I don't think, I don't know all the billionaires, but all these uber wealthy people don't need more help from the government. So why are we making it that we are cutting taxes for the ultra wealthy at the expense of the most vulnerable, because the government, in my opinion, should be out there helping the most vulnerable so they get to a point where they are contributing more than they already are. Because these people are contributing, I don't care what you say, they're contributing to taxes to pay for this stuff, and then they're doing jobs. They're doing jobs that we all want done. You know, they're your grocers at the store. They're taking care of our kids at daycare. They're taking our order when we go out to eat. They are, you know, cleaning the hospitals, the custodians at the hospital. These are all people who are working and working jobs that are needed. And then we're telling them to, you know what, screw you. Jeff Bezos and Elon Musk need more money. They need to be able to write off the whole private jet they're buying. And I'm sorry, we're going to cut your Medicaid, so you might have to figure out how you're going to get your medication next time. We can do better. I believe we can do better in this country. We should do better. There's no reason why we can't take care of our fellow citizens the way we take care of the ultra rich. And I want you to think about that as I leave, is why is it so important that we have socialism for the rich? Because that's what it is. We have socialism for the rich, and then we have pure capitalism for everybody else, where, you know what, you're not working. The politicians say, you're not working hard enough. Why aren't you doing this? Why aren't you doing that? But we're giving tax breaks to the people who already have so much. You know, I don't need a tax break. I'm fine. I don't need one. And it wouldn't bother me if my government said, hey, can you give a little more? Because my government was there to help me when I was growing up as a kid. And I have no problem helping other people out who need it. And it's this type of mentality that we have in this country where we look down on people who need help and we look up to people who are taking the most from us. And it's the ultra wealthy, the ultra rich, who lobby to get what they want at our expense. So think about that. Think about how some of these people on Medicaid are your neighbors, are kids that your kids might be friends with some of these kids who rely on these programs, and you don't know it. Why is it bothering you then? Let's all just try to do better in our lives and move on and help each other out. It's not that much. We're already paying the sales tax. I don't care. Why should you care who's getting health care or who's not? If you're getting health care and somebody else is getting health care, great. We're all getting health care. You know, we're not all getting private jets. So why we making tax laws to write that off? You know, that's not a net benefit to us. It's a net benefit to the rich who can just go parade around the world wherever they want. But it's not net. It doesn't help the guy down the street, the family down the street, put food on their table, get health care for their kids, or to live a better life. So again, remember that we have a voice. Let's all use it.